Hi, everybody. This is Andrea, president of the Stigma-Free Society. I just want to welcome all of our viewers today. Today we have a very special guest, Ed Staples. He is talking to us through a satellite internet connection, so there will be a little bit of delay in his answers. And that is just the reality of today and technology and rural communities specifically when it comes to internet connections. But this conversation is very important. We are extremely excited to have Ed here with us today. And I'm going to share a bio about Ed to just share a little bit more about him. So Ed Staples lives in the Tulameen River Valley near Princeton, BC, where he is actively involved in improving access to healthcare services in his community. He is the president of the BC Rural Health Network, a member of the BC Health Coalition Steering Committee, member of the core group of the Rural Coordination Centre of BC, co-chair of the Rural Citizens Perspective Group, and as well co-chair of the Princeton Community Health Table. The Princeton Community Health Table was formed in July 2020. It was a direct response to mental health and substance use concerns in the community. The PCHT is working to remove barriers to accessing mental health services, including stigmatization. Thank you so much for being here today.
Yeah, it's my pleasure. Thank you, Andrea, for including me in this conversation. Looking forward to it.
Excellent. So I was wondering if you could start off telling us a little bit about yourself, maybe as well how you got involved in these amazing rural health initiatives. Was there a personal story behind it? What fuels you and what's your passions?
Yeah, sure. Maybe the best place to start would be to go back to May of 2012 when Interior Health announced that they would be closing our ER services in Princeton 4 nights a week, mainly due to a lack of a shortage of doctors that could do on-call work in our community. And that prompted quite an outcry in our community, especially with my wife, who decided that we needed to do something about it. She dragged me, kicking and screaming, into getting involved, and I have never looked back. Out of that crisis that developed locally, we formed a group called Support Our Healthcare Society, which the idea was that we would try to address the problems head on. We started with a very confrontational approach, which over time changed into more collaborative. And as I say, we've really never looked back. That land led to the formation of the BC Rural Health Network, because we soon discovered that we weren't alone in this, that there were other communities in the province that were facing the same problems. And we formed this group with originally six community organizations. We are now up to 52 members in the BC Rural Health Network. So we continue to grow. The other group that you mentioned is the BC Health Coalition. Early on, I recognized the value of being involved with that provincial organization and been involved on their steering committee for the past several years. And you've also mentioned the Princeton Community Health Table. That's a recent group that was formed that addresses very specific concerns with mental health and substance use in our community.
Yeah, very different groups, all interrelated, and such amazing initiatives that you have spearheaded and become a part of. I was wondering, with a few of them, I know there's quite a few that you've mentioned, what kind of specific initiatives, for instance, would one of these organizations provide around mental health in rural communities?
Yeah, I think before you go into any real discussion on the initiatives, I think it's important to just identify the key element here as far as what's um, what's involved with these concerns. The central problem really can be summed up in one word, and that's access. For people living in rural communities throughout BC, there is a lot of difficulty in accessing the services, either locally as a result of minor transportation issues, or because the services just don't exist, or it could be that there's a difficulty in getting to the services that are required away from home. But that's probably one of the main problems that we face. So to address those issues, we're trying to improve things like transportation and to improve access to care across the board. And that means trying to help out when it comes to recruiting and retaining healthcare professionals, working with both local and regional and provincial decision makers to try to improve the situation for people that are living in rural BC. So it's a myriad of different activities and initiatives that we're involved in. Unfortunately, I wish I could report that we've made a lot of progress in this area, but to date, progress has been very slow and in some cases non-existent in addressing rural problems, both in terms of addressing mental health, but in public health care in general.
Yeah, and you mentioned transportation being an issue, infrastructure, and access. And is there any other types of barriers for people accessing mental health or substance use services that you have found exist in rural communities? I think it would be important to shed some light on that so people understand the issues and the barriers that people are facing in these communities.
Right. So you've already mentioned in my bio, stigmatization is a huge barrier, and we can talk endlessly on that particular topic. And of course, that's the kind of the focus of this organization and today's discussion. So stigma is a huge barrier. It may be one of the most important ones that we have to deal with in rural communities. As you can appreciate, when you live in a rural community, maybe you don't appreciate it, but I certainly appreciate the fact that when you live in a rural community, everybody tends to know everybody else's business because of the nature of the size of the community. And as a result, when people face issues, mental health issues or substance use issues, it's sometimes difficult for them to access the care, partly because they're afraid of what that might mean to how it might be read and how it might prevent them from accessing the care, simply because they're afraid of what people might think or what they might know about themselves. So that's a big part of it. The other part of it is people don't know how to access the care. And that's not just a rural issue. I think that that's something that needs to be addressed across the board. Sometimes the care is there, but people that need that care just don't know how and where to go to access the care that's needed. And I think also it's important for us to recognize the fact that we're all living in this pandemic time of the COVID-19 pandemic, and that has also created some barriers to care, partly because it has isolated people, and partly because there's also an uptick, an increase in the number of people who are looking for and require care as a result of COVID-19. And that's put a stress on the already stressed services that are available locally.
Yeah, no, thank you so much for that. Very informative. Stigma, of course, at the Stigma-Free Society is a central theme, and we really like to bring on guests who can shed light onto the various stigmas that exist in society. I know that I have talked to so many people, especially men, farmers, who live in rural communities. And do you feel like the stigma for men is quite different or is increased for them?
Yeah, it's a good question. I'm not sure I know the answer to that. Um, I think the answer is possibly, but
Mhm.
I don't really have any experience that would show that to be true. I think that
Mhm.
that the stigma is not, well, it's not really identified in terms of male female. I think I think the stigma often is more age related than it is
Mhm.
actually related to whether you're male or female. Because I think
Right.
that's the the age factor is, um, I think young people perhaps are a little bit more open to understanding and recognizing that they might need help,
Mhm.
whereas older people, people in my generation, um, I think tend to be a little bit more reluctant to seek help because of the fear that it sends a message to their friends and family that there's something wrong with them, and
Yeah.
um, it doesn't seem to apply when it comes to physical ailments. It really only applies when it comes to mental health or substance use issues.
Yeah. And I was curious as well. I find a lot of people who work in mental health and are passionate about breaking down stigmas in the rural community and beyond, people even in urban counterparts, have a story to tell, like a personal experience or something that, is there something that led you on to this journey that really inspired you in your personal life?
Um, well, yes, my own personal journey um, with alcohol addiction, which is sometimes viewed as not being a substance use problem, but it is. It's a huge problem, might be the biggest problem that exists in society.
Mhm.
And I tackled that 6 years ago on October 1st. And it has been a very important thing for me to recognize that addiction um, is, you don't choose to be an addict. You don't somehow fall into being an addict. Um,
Mhm.
Addiction is something that people have a certain leaning towards as a result of, of a genetic situation. What you're born with has a huge is a huge factor in terms of what addiction will mean to you in your life. And I think we need to recognize that. We need to
Mhm.
eliminate that as one of the barriers to for people to actually um, get care. So I really
Yeah.
wasn't prepared to get into this in too much detail, but I think it is important that, from my perspective, that is recognized as a very important part of the discussion and for the solution.
Yeah, thank you so much for being so candid and authentic. I really appreciate that. I feel when people share their personal stories, it inspires other people often to get help identify in those stories and to be inspired. So, thank you so much for being very amazingly authentic. I really appreciate that. And one of the things
Yeah,
I was
no problem.
curious about as well was for substance use in rural communities, is this an increasing issue? Do you know if that is more predominant than perhaps it is in the urban realm? I've heard that perhaps it is, but I was just wondering a little bit about your insight into substance use in rural communities and how does that play out in these communities? Is it different?
Yeah, it's a really good question, Andrea. I think um, most people, especially people living in urban centers, think of the drug overdose issue and deaths caused by drug overdose as being largely an urban centric problem. Um, Look at the press that you get from the overdose problem in centers like Vancouver. However,
Mhm.
that really doesn't speak to the problem that's happening in rural. And I'll give you as an example in our community here in Princeton, when uh, the crisis, the overdose crisis, was in its peak. Princeton had the highest per capita overdose death rate in the province. And that had a huge impact on our community. My wife and I personally know of someone, husband and wife, who are friends of ours who lost a son during that period of time. So especially in a rural community, it has a huge impact. I'm not saying, I don't want to say that it doesn't have an impact in urban. Of course it does, but I think it affects a larger percentage of the population when it happens in such a small community where it's very tight knit and everybody does know each other in some capacity. So I think that's really important to know. As far as the root cause of all of that, I really couldn't speak to it, but it is definitely a problem.
In talking to a lot of individuals from rural communities, it plays out very differently, as you were mentioning. People know each other in the communities, and people have said, I will not go into a doctor's office because what if somebody sees me? And so there's that stigma. I was curious if you have any recommendations or thoughts around how can community members support each other? What can they do?
Yeah, great question. What we're trying to do through the Princeton Community Health Table is to set up a peer support, peer counseling initiative here, and I think that's maybe one of the better ways of addressing the issue of mental health and substance use. It's difficult for people, as you pointed out, to seek help from a professional when stigma prevents them from doing that. And we can get into what we can do to maybe alleviate stigma as well. But I think the idea of peer support and peer counseling, to me, is one of the best ways that we can address the issue. The other is what is referred to, what you may be aware of. It's the mental health first aid course that's available to people. And we're very fortunate in our community to just recently, the Princeton Community Health Table has received a grant from Weyerhaeuser, one of our local employers here, that will provide funds for us to train 15 local people in the mental health first aid course, which is offered through the Canadian Mental Health Association. And the idea is that we will then provide support alongside the healthcare professionals to address the issues, because it's partly about the issue of seeking out people that are not necessarily directly involved at the highest levels, and it brings it down to the grassroots level, which I think is going to be very helpful. As to the need to address stigma, to me, the best way is education. My background is in education. I was a teacher for 34 years, so I value the aspects of education. If we can start early, start young, to change the mindset in the community right from the early ages in the elementary school, then I think that we'll go a long way to address the stigma that's attached. When the children become stigma-free, then there's a greater chance the parents will become stigma-free. And when the parents become stigma-free, the community becomes stigma-free. So I think that's where you start. I think you also need to address it outside of the youth. High school, locally, we hired a person to speak, an expert to speak to our high school students. We developed brochures. We had a public forum where we talked about stigma. So there's lots of things that can be done to eliminate or at least ameliorate the problems that surround stigma.
Yeah. Ed, I think you would really benefit, and we would benefit from connecting with you after this call and to do some follow-up, because the Stigma-Free Society has a program called the Student Mental Health Toolkit, and it is resources for grades 4 to 12. We have live presenters come into the classrooms on Zoom, and we would love to connect with you and bring these resources to your community. As well, we have a peer support training coming up in November, which is free. I'd love to reach out to you and offer it to, we have 24 spots at this point, and this is through Robin Priest, Live Your Truth, a professional peer support trainer. And wow, everything we're saying here today just really resonates with a lot of what we're doing and a lot of what you're trying to accomplish as well. I see some really amazing synergies.
Yeah, absolutely. That's fantastic, Andrea. Yes, let's get together after this, because what you're saying, that's very exciting. Yeah, let's do it.
Yeah. And maybe for people out there, I know I understand peer support. I ignited quite a few groups in my day, and you understand it. But maybe some people watching just really don't know what peer support is and why it would play out so well in a rural community. How would you define peer support, and why would it be beneficial for your community and communities like yours?
Yeah, you're putting me a little bit on the spot on this one, but I'll do my best. um, I guess the best way to describe peer support is to identify people in the community with lived experience, people who have either are living with or have lived with substance use or mental health issues, and have been working to conquer those problems on their own or with the help of others. And often those people that are aware of the situation in a very real, meaningful way are the best people to help others that are experiencing the same kinds of problems. And then the other part of this is how you make that connection, that it's all done in confidence. It's a confidential approach where in a one-on-one situation or in a small group situation where people get together to identify their problems, their issues with mental health and with substance use, and to develop strategies, I guess, that have worked, identify strategies that have worked for others that might work for someone who is seeking help. I think maybe that's probably the best way to describe it. So yeah, that's probably all I need to say about that. So thanks.
Yeah, that's an astounding explanation. I love how you framed that. And I think with peer support as well, like you said, it's that lived experience. And yes, medical professionals are great, and counselors and RCCs, wonderful help, wonderful people, but there's nothing like talking to somebody who has walked the walk, somebody who has a mental illness when you're talking to somebody else who has a mental illness or a substance use issue, vice versa. So I really appreciate your definition. I feel like you hit it out of the ballpark, per se.
Well, thank you. Thanks, appreciate it.
Yeah. So is there anything else you would like to add on the topics we've covered today? Anything else you feel you would like to highlight, perhaps around some of the work you're doing or anything upcoming initiatives, anything at all?
I guess the one thing that we haven't talked about, or I haven't mentioned at this point, is the whole concept of community engagement and community resources. I am a huge believer in the fact that communities and community individuals know what's best for themselves and for their community as a result of lived experience. And I think that we need to go a lot further to engage the community in the decision-making process when it comes to decisions that are being made for people's health.
Mm-hmm.
There's often lip service paid to that, but I think that is too often just it's a way for healthcare professionals, policymakers to include people and then tick that box and say, okay, we've involved them. But if it's not involvement at a high level where people are there's collaboration and people are empowered to make decisions on their own behalf, then I think that there's little value in it. And
Mm-hmm.
I've learned, especially in the work that I'm doing here in Princeton, that the local knowledge and expertise is largely an untapped resource in this community, and I would guess it's an untapped resource in other communities as well. So what we're going to be doing here in Princeton is going through a community mapping process where we're going to identify people, organizations, services, facilities, infrastructures, all of those things that exist within the community that relate to mental health and substance use in the community, and find a way as a result of that to develop strategies that use local knowledge, expertise as a way to address the problems. You don't always have to go to expect change to come from higher levels, from the health authority or from the province. I think a lot of the change and a lot of the solutions exist locally, and that's what we're trying to do here. And I think we've been somewhat successful. I think we still have a long way to go, but we're just getting started. And I encourage anybody that is listening today to think about that when they are thinking about the problems that exist in their communities.
Yeah, very important community engagement, whether that's surveys or getting feedback and engaging the communities and what they want, what they feel they need. And it's not this big macro view of what's being told to do. And I really love that concept. And I see such value in that, where the voices of the people are heard in the community. They know what they want. They know what they need. So I really appreciate that.
Yeah, it's
Okay.
I think it's huge, and we can do a lot better.
Yeah. Great. And is there anything else you would like to?
I don't know if we have any more time, Andrea.
Yeah.
Yeah,
We're
I'm
good.
just going to say one more thing that we. Okay, good. So I think the other thing that I'd like to mention is the importance of recognizing the social determinants of health and the impact that has on mental health and substance use in the community. You can draw a direct link, I believe, between how well a community addresses things like poverty, employment, housing, nutrition, all of those things that affect the way people live, and as a result, the way that they deal with their health issues. And very often, I think in these communities that in our communities like mine, if the social determinants of health are not addressed first, often what's referred to as the upstream, then all of the downstream effects are going to be magnified, and it will be a continual problem until we address those upstream issues. Then the downstream is going to be pretty difficult to correct.
You answered my last question anyway, so definitely have more time for you and everything you're talking about. You answered right when I was going to ask you, so that was perfect.
Good.
Okay.
Do you have any other questions for me?
No, I am good. I just wanted to say thank you so much for your insight, your knowledge, your passion. It's been a really nice experience talking with you, and I'd like you to stay on after the call, and we can talk about possible collaboration and synergies going forward and how we can help each other. And we're very passionate at Stigma-Free Society with bringing mental health resources into the schools, into the rural communities, peer support. So I think I was meant to meet you, to be very honest.
Yeah, well, I can echo that, Andrea. I feel the same way, and I think there is a lot that we can do in the work that we're trying to do together, and that's what it's all about. I've maintained for the longest time that to make change happen, it's all about relationships, and I'm really, really happy that we've developed this relationship and continue. So yeah, thank you so much.
All right. Thank you, everybody. Thank you, Ed. And just want to say have a wonderful day to everybody. Check out our ruralmentalwellness.com website, where our toolkit provides resources and downloadable resources that you could have at home, activities, a family section, live events like this one. And we really appreciate everybody tuning in today. So thank you, Ed, and thank you, everybody. Have a lovely day. Bye now.
Thank you. Bye-bye.